Ships are safe in the harbor, but ships are not meant to be in the harbor. They're meant for the open ocean. Hello, everyone. I'm Dr. Adam Sewell, and welcome to the first episode of Medical Entrepreneur Podcast. I'm so excited you're here today. Today, we're going to be going through my journey of becoming a medical entrepreneur so that you can see what I went through to find out if this journey is right for you so that you can make a pivot to living your life at a highest level, serving the most people, and making the best impact you can. One of the things that really shaped me was the fact that when I grew up, we were very, very poor as a family. We were so poor, in fact, that we basically lived in essentially what were the projects, and we lived on government commodities. Things went on like this for a while, and I got tired of not having anything. All the other kids in school would have, birthday presents, would have new shirts, new shoes, etc. And so I started to actually go through dumpsters that were in the neighborhood, and I would actually find things that people had thrown away, and then I would resell them to other people. And I remember it started out, I found some like little covers that would you basically put down like on a bench, like when you go see a game that belonged to SMU. I found some nunchucks that I actually resold. I found a lot of things. And that was like my first entry into the fact that I didn't have to rely on anyone else to make money, but I started to realize that I could make money on my own. And so technically that was my first step in being an entrepreneur. And things continue like that until about middle school when everything changed. As you might imagine, it started with a girl. So I was in middle school, sixth grade. This was a new school. I thought when you asked a girl out, it meant like you might go out to the movies or something like this. What I found out later is that when you asked a girl out, it meant that both of you essentially stared at the floor and tried to avoid each other out of nervousness. But anyway, I'd asked a girl out to a slow dance, and we were basically getting ready to dance. We both entered the dance floor. I was a little nervous. I think she was a little nervous. And at that time, one of our class members jumped from the balcony onto the dance floor, shattering both his legs. And I remember standing there, having my slow dance ruined, looking around, just thinking, this makes no sense. Not only could I not get my slow dance, but we were doing fractions again for the X number of times. I mean, so we've done the same thing over and over and over. And I knew I'd seen this show on TV called Doogie Howser, and I knew he didn't have to go to high school. He didn't have to go through all this. And so I decided to move forward and try to basically go from middle school straight to college. So I ended up actually starting college at the age of 13. I would go to middle school during the day. And then at night, I would go to the local community college. I continued that, ended up graduating college 2 weeks after turning 18. My intention was to go forward and go on to medical school. However, back in those days, they had a paper application for the MCAT. And I remember I mailed my application in, but I was told that it never arrived, which was really unfortunate, but it shifted my life into a different direction. So it was about that time where I received a call from my friend who was in New York at the time, like it was actually in Manhattan, New York. He said, hey, you need to come up here and check out what's going on. There's so much activity. The year was like 1999. The internet was brand new. There's so much exciting things. And so I was able to basically move to Manhattan and work with him. And we ended up building our first company together, essentially building websites. We actually later sold it. Once I sold my company, I had to figure out what to do next. I decided to go back to my initial goal of basically becoming a doctor. I went to medical school at the University of Texas Medical Branch in Galveston, Texas. And then while I was there, I, had exposure to all these different fields of medicine, and I really enjoyed anesthesia. And kind of like I always do, I tend to get like hyper focused on a thing. And I really got into anesthesia. And part of the way that I was able to pay for my medical school was, in addition to being the local photographer for the yearbook, I was also worked at night as an anesthesia technician. And so I would basically come at night after my med school and would set up the operating room for the anesthesiologists and the CRNAs. And I basically put out set up the trays, set up like all the different parts of it, set up their suction, etc. I worked in the operating room to the point where I would actually become really quite proficient. By the time I had finished medical school, not only had I done all the regular stuff that most people do in medical school, but I'd already done over 1,000 spinals and epidurals even before going to residency. So I'd really done that, and I poured, my focus into that because I just love the idea of anesthesia. It's such a fascinating field. It's so complex. Having the exposure to so many opportunities to help people was amazing. And one thing I found out during my experience was that, especially late at night, whoever is willing to do the work will get it. So, so many times I would be working for residents and these things who they'd be busy, they'd be on call, they'd be in the call room, whatever, they'd be on call for, 24 hours or something like this. And they would get a call for an epidural spinal. And because I was always, Johnny on the spot, I was always ready to go. They'd often hand the work to me. So I would go do it and I would basically place an epidural, have everything lined out for them. So they literally showed up, signed their paperwork, checked my work, and was good to go. And because of that, they came to rely on me. And so I was able to get so many procedures. When I was in medical school, I knew I wanted to do anesthesia. And in Galveston, we had some trauma anesthesia. It wasn't that big. And I really loved the focus and the critical nature of like emergency anesthesia. And so I really had two choices. One, go to Cook in Chicago for anesthesia, or two, go to Miami. Both had really great trauma programs. And both were really well respected. So between the two, I chose Miami for the better weather and the better life, I guess. After I finished all my training, I was looking for a 1099 contract because I knew and I'd seen enough during my training to realize that I wanted to have my own company. I'd seen the hospital administrators there. I'd seen the power plays between administration and physicians and nurses and all this kind of stuff. And I figured, the best way to go would basically be to have my own contract as 1099. Not only was it better, in terms of taxes, but I could be my own company because I could be independent and I didn't have anybody tell me what I could or what I couldn't do. And so I found a contract in this little tiny town called Fort Smith, Arkansas. And this town was on the western side of Arkansas, kind of where Arkansas touches Oklahoma. It was a tough job. Like you're basically on call every third night. And it was a very hard place to recruit people too, because the town was essentially not known for very much. It was known as the place Whirlpool used to be. Like literally, that was their claim to fame. That they had a large Whirlpool factory that was at the time abandoned. The other thing they were known for was that they had the best airport bathrooms. Somehow they'd won an award for that. So this was a little town, and so just kind of poured myself into work. I started doing more and more cases. And I remember one day I saw a lady who was in the recovery, and then we call a PACU, area where people recover after anesthesia. And this lady had pancreatic cancer that had basically grown and started to invade part of her body. When pancreatic cancer does that, it can be quite painful depending on where it invades. And this lady was in terrible pain. She was on a lot of different medications, severely in pain. And I spoke to her and I asked her, hey, has someone ever done or offered you a block to turn that pain off? And she looked at me, with eyes, wide as saucers and basically said, no, like, what are you talking about? Like, I would do anything to get out of this pain. I said, well, there's a very simple block we can do. Literally it'll take, maybe like 30 minutes and we can actually turn that pain off. And if that works, we can then make it permanent. And she was so excited. I mentioned that to her. She came back, I think about a week later, and we did that. And it took away all of her pain. And then after that, I started to develop kind of a reputation for helping people in pain. So the next thing I got was the referral for a doctor's wife who had back pain, and we wanted to fix that. So I did a procedure for her and fixed that. And then pretty soon I went to the hospital and I talked to them and said, hey, there's a lot of patients that have, pain related issues. Why don't we have a pain program here? And they said, well, we'd had one before and it was unprofitable. Now, keeping in mind that at this time, like pain management was one of the most profitable subfields of anesthesia. So when they said that, I knew they didn't know what they were talking about. But I tried to discuss that with them. I even tried to speak to the hospital administrators and say, hey, you actually have large amounts of area of this hospital that are essentially abandoned. Like they had an operating room and then they had an old operating room that was maybe from like the 70s, where there's nothing wrong with the operating room. It was a little bit dated, but everything worked fine. And I said, well, why don't we use the old operating room area to help these people in pain? And they'll open up a whole new service line for you. I was told that according to the administrators of the hospital, when they ran the numbers, it didn't make sense to do that or something to that effect. So I tried to go to the hospital and say, hey, you have that big, the series of an old operating room from the 70s. You're not using it for anything right now. You literally are storing junk in it. It's totally unused. Can I rent that from you so that I can perform procedures and help your patients, That way you don't have to worry about the cost of anything. If anything, I'm paying you money. and I'll just help these people and I'll try to figure out how this works. They wouldn't have any of it. So I basically had to go and I found an oral surgeon who I basically was helping do anesthesia for. So like this guy would do like wisdom teeth extractions, etc. And on some cases, he would need an anesthesiologist to basically put these people asleep. I would do anesthesia for him, and I basically said, "Hey, is there a way I could rent out your clinic during the times you don't use it?" I would rent out his clinic at night whenever he didn't have the clinic running. So I started out building my first practice, seeing pain patients essentially at night. So I basically Monday at 6 a.m. I would start. Say I was on call that day, I'd be on Monday at 6 a.m. and I basically go from 6 a.m. to the next day at like noon. Then I would be post call. So normally you go home and sleep. I would go instead of being post call, I'd go to my clinic and I'd go start my clinic at like 1 p.m. and work on my clinic from 1 p.m. to midnight. And so oftentimes people would get an appointment and says, oh, your appointment's at 8. Is that 8 a.m.? No, 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 that's 8 p.m. It was such a joke sometimes. And I look at it now, it's a little crazy, but that's what it took to get my first clinic up and running. And almost immediately we were very popular because there was no one helping these people. People were in a lot of pain. I guess many of the physicians in the area were unfamiliar with some of the more common, anesthesia technologies for pain management. And it came to a point where even one time, I remember we were in clinic and I think it was like kind of later in the evening, like 7 or 8 or something. And we hear this bang, bang, bang on the back door, because there was the front door where patients came through and there's a back door as well. And, we were like, oh man, what's going on? Like, should we open it? Should we not? And we opened the door and there was a lady from a doctor's office that was kind of maybe like a couple blocks away. And she had just shown up with literally 40 charts, like a whole stack of charts. Because here's some referrals for you. We want to give you all these patients. I was, so grateful, and I went and basically accepted those. But it really made me realize that, like, being in the right place in the right time is really critical. But also doing the right thing, because I know that if I could help people, eventually the business would come. And that's kind of where the hospital administrators were backwards, is they were looking, trying to figure like, okay, where's the profit in this? But so often the profit is after you do the thing that helps people, you know? So that was kind of a life lesson for me. That was just the beginning. There was a lot of obstacles on the way to becoming a medical entrepreneur because I didn't really know about the business side of being a medical entrepreneur. So I was trying to figure this out while I did the clinical side. So one of the things that happened was that I started to get more and more popular, to the point where like most of the surgeons that I was also doing anesthesia for were also familiar with me doing pain management, and many times would give me their kind of problem children, if you will. So like if they had a patient that, maybe had surgery and they still had pain or still had an issue, they would just refer them to me, and it's up to me to figure out kind of what's going on and get them better. So I started getting more and more referrals. And finally, to a point where the chief of anesthesia came to me one day and said, "Hey, look, we know that you're doing this clinic. We know that your clinic is growing. We're worried that you're going to basically be unable to do your normal full-time job, which is Q3 call, and also do your clinic." He came to me and it was essentially to the point where it's like, well, you need to give up one of the two things. One, you can stay here, but you basically have to tell me that you're not going to do your clinic anymore and you're going to be a full-time anesthesiologist and focus on your job here. Or two, you need to essentially resign because I need to have your salary to find another doctor who is just graduating or just finishing their training and recruit them here. And so it was a very scary time because for me at the time, like we had not made any money. Essentially, I was using my salary, the money I was making from being an anesthesiologist, to essentially fund my clinic to take care of these patients. And so I had to figure this out because it was really scary. Basically, if I ended up leaving the job, I didn't know if the clinic was ever going to be profitable. I didn't know if it was going to make enough money to even pay its own bills, let alone pay for me or anything. And so I had to sit down, and I remember making this decision. And there was a quote that I'd heard, and the quote said, "Ships are safe in the harbor, but ships are not meant to be in the harbor. They're meant for the open ocean." Something about that just resonated with me. And I knew that, like, I'm safe in this job. I do the same thing every day. It's, safe. I get paid decent. Like, I know how to do this. I could probably do the job blindfolded. But there was something inside of me that wanted more, that knew that I could become more. it was like a desire in my chest. Like I could feel it. And I remember thinking, like, you know what? Let's just do this. Let's just do this. I understand there's a risk. I could go bankrupt, which would be pretty embarrassing, just finishing your training and going bankrupt right away. But like basically I was like, you know what? I may go bankrupt trying this, but I'm gonna try it because although I am safe in the harbor, although I am safe in my job, I'm not meant to just do that. Like I know there's more to me than just a guy who gives anesthesia and does whatever his boss says. And no disrespect to any of that, but it's just like I knew there was something more, and I knew that I could achieve it. And so I wanted to take a chance, to take a chance on myself, to take a chance on my future, to do something greater. And I think that really encapsulates the driver for entrepreneurs. I would say there's probably like about a 50-50 chance of me going bankrupt when I made that decision. But as soon as I made the decision, I was all in. And I knew that I had to leave that job. So I told my boss that. He immediately started recruiting another doctor. And I knew that I was on a clock because I only had, I think, 2 months essentially of salary before this new doctor would start. And so I had to figure out, basically, hey, we need to make this clinic run and we need to get paid. We got bills to pay, we got employees to pay. And unfortunately, I can't just pay them out of my salary anymore because I'm not going to have it. And so I knew also the time that I knew that on my deathbed, looking back at the situation, that if I look back, I would regret not trying more than I would regret failing. And so I just went for it and basically went all in and ended up building a very large clinic in Fort Smith, Arkansas, that saw thousands of patients. It helped thousands of patients with their pain. The next stage of my growth was essentially I built the pain management clinic. We got to a very large size. We had basically an orthopedic surgeon, we had a neurosurgeon, we had multiple nurse practitioners, and we really were achieving what in my mind was a really great opportunity for patients, because traditionally patients would have to go see a neurosurgeon and then come to clinic to see a pain management doctor. Then they have to go see a different doctor, like an orthopedic surgeon. We had them all in one clinic. We basically built that up over about 6 to 7 years. And then something started to change in the industry. Healthcare just became significantly more aggressive. The insurance companies became very, very difficult to deal with. In the past, when you had a patient, you could call them, you could write a letter, you could send some kind of communication indicating that, like, hey, we know your policy doesn't allow this per se, or like you block this service, but this patient has XYZ and they really need this service and would help them. And they would just approve it because they wanted to do what was best for the patient. About this time, we started seeing insurance companies who just really didn't care anymore. It didn't matter what the patient needed. It didn't matter if the patient did good or bad. They were to the point where it's like, we're denying this and there's really not much you can do about it. It really kind of soured my view on mainstream medicine because we weren't treating patients anymore. We were basically, essentially appliers of whatever the algorithm was for that insurance. And you could try to fight with them, but in most of the cases, the fighting was worthless, and of course, always unpaid. You don't get paid at all for writing those letters, for making those calls. And so they were basically dragging the practice down in a lot of cases. What we started to do is started to get outside of traditional mainstream medicine by opening a medical spa. I always liked the idea of a medical spa. I'd heard some other people having medical spas, and the idea of getting to a kind of cash-based system really made a lot of sense, because right before then, I remember being in clinic this day, and we had a patient that came and basically flushed a whole bunch of stuff down the toilet and jammed it up. We had to call an emergency plumber. The emergency plumber came, did their thing. Like 5 minutes later, told it was working, and left with a bill for $350. I remember thinking, like, my God, no, this plumber makes more dollars per hour than I do, doing procedures in someone's spine, doing an injection in someone's neck, or applying a stimulator, putting a wire in someone's spine. The plumber made more dollars per hour. I remember thinking, like, wow, this really doesn't make sense. So it just kind of fueled me more to kind of see what else could I build where I could take the insurance company out of the picture, because I felt like the insurance company was really destroying the relationship between the physician and the patient, or the provider and the patient. We built the first med spa, and that's when I started to realize you could see less patients because people were paying cash. There wasn't the whole issue of like basically insurance. So normally what happens when you see a patient who has insurance is that you see them, you have to get their insurance card, you got to call the insurance company. Usually it's not you. Usually you got to hire somebody to call the insurance company, make sure their insurance is active. Then, either sit on hold or use a series of computer systems to gather what their insurance will and will not cover, what the deductible is, all these very complicated things just to figure out if you can see this person. Then they actually get there for your medical care. Then you got to file a claim on your insurance. You got to basically pay somebody to basically bill that, to monitor that, keeping in mind that almost all insurances throw away 10% of their claims immediately because they know that, hey, if they just throw away 10%, some percentage of people will never go back and try to get those claims again. So you have to basically hire somebody whose full-time job is essentially to bill the insurance, to stay on them, to make sure they pay, and to make sure they pay fairly. That obviously costs some money to do that. All of this work just to treat people. And then once I was able to get to the medical spa, there was none of that. You can meet a patient, you could spend an hour with them, because on the other side of the clinic, we had to see people all the time and had very, very high volumes of patients just to make sure it made sense financially to pay everybody's salary. On the medical spa side, we didn't have to see that many patients because each patient was worth more. Additionally, we could actually talk to a patient and explain things to them, and we had time to work with them. And if we thought there was a procedure that would help them, we could tell them and they could do it. And it wasn't like you had to go fill out 5 forms and fax it and call 3 people and all this stuff. It was just very simple. And so I started to kind of fall in love with the whole business of non-insurance based medicine, or kind of cash based clinics, if you will. And that's where I started to really see the difference between the traditional mainstream medicine and the kind of medical entrepreneur pathway, kind of a new life versus old life. We could see 10 patients on the med spa side and make the same amount of money as seeing 30 to 40 patients on the other side. The med spa patients in general were nicer, kinder, easier to deal with. On the other side, you had a lot of people that had government insurance, which itself was very difficult to deal with. In the state where we were, was Arkansas at the time, we had a lot of people that had Medicaid. And the Arkansas Medicaid system is very messed up. But one of the things that happens is Medicaid is that they only get so many visits per year. And so everybody who has Medicaid knows this. And so what happens is when that Medicaid renews, they go see all the doctors they can in that first week. If you're after that first 4 doctors, you just don't get paid. And then later, essentially after that, if in Arkansas Medicaid, if they don't have enough money to pay their doctors, they have a thing called spin down, which means that no matter what your charge is, if the state of Arkansas doesn't have enough money, it will just essentially discount your services to whatever level it feels that it can pay. By seeing a Medicaid patient in Arkansas, you're kind of just like rolling the dice. There's a big chance that like you won't get paid or get paid fairly by doing that. You could deal with that, or you could deal with somebody who is genuinely glad to be there, genuinely glad to see you. You can spend an hour talking to them because it made sense financially. You could recommend a procedure and there was no red tape, no 1,000-page documents you had to provide, none of that. And you could help them. I started to see this new life as the way medicine was always meant to be, kind of before insurances really got more involved in healthcare. I was also able to spend more time with my family because I wasn't working as much, because each patient was more valuable to me. And also, I feel like I had a more deeper connection to the patient because I was able to spend more time with them. And at the end of the day, a lot of the reasons why doctors have to see patients so quickly is because the reimbursement is so low. Keep in mind, like a level 1 visit for Medicare reimburses something like $20. That's total, So it really doesn't make a lot of sense to do that. So what I realized is that going to the new system of, building medical spas, seeing people for cash rather than deal with insurance, it really allowed me to restore my practice of medicine. So if you're ready to start your journey as a medical entrepreneur, then please join us at freedomthroughprosperity.com. We have a saying as medical entrepreneurs: one vision, one purpose, freedom through prosperity.